We're here at Faith Regional and getting ready to learn more about cervical cancer. Let's talk to the doctors who treat it. Dr. Alex Laudenklos, an obstetrician and gynecologist with Faith Regional Physician Services, is with me now. Doctor, we're talking about cervical cancer, and let's begin with screenings. What are some of the screenings you can do to detect this?
For the most part, for the general population, screening starts at the age of 21, and right now it's based off of a pap smear. So we collect a pap smear of the cervix, or a swab of the cervix, basically. Look at it the pathologist looks at it underneath the microscope and then gives us a reading of results for that. Once we hit the age of 30, then we start testing for HPV. And once we add that combination in there, if everything stays negative, then we can get out to once every 5 years.
What are some of the symptoms that you're looking out for?
So most cervical cancers, early stages are going to be asymptomatic. Women aren't really going to have symptoms from a cervical cancer standpoint.
If there's no symptoms, that means it's that much more important to get the screenings, right?
Correct. And the screenings are that much more important because a lot of what we're able to do and a lot of what we're able to accomplish based off the screenings is both early diagnosis and early treatment.
If there is a diagnosis for cervical cancer, what does the treatment look like?
So the treatment for cervical cancer varies. Depending on the size and the advancement of the cervical cancer, it can be anywhere from a small biopsy procedure to the other extreme that may need radiation chemotherapy versus those that are done with childbearing. Typically, those we move on to a hysterectomy.
Now, what age of women should be concerned about getting screened?
Starting at the age of 21 all the way up to 65 or maybe even later depending on your previous pap smear history. And then younger than 21 is kind of a patient discussion with their provider depending on certain risk factors like immunocompromising medications or immunocompromising medical problems.
Well, Dr. Laudenklos, thanks so much for sharing your expertise.
Absolutely. Thank you.